The solution to pollution is just pick up the litter. Correct? Wrong. Like many other things in life, it is a much more complicated issue.
We all know that pollution is bad for the environment. No matter where we go, we find ourselves in environments shared with other people and animals. It makes sense then to say that the pollution we cause affects us, other people around us, animals in the environment, as well as the environment itself. One Health emphasizes the intricate connections between animal, human, and environmental health. An issue with one will invariably negatively affect the other. This is the case with pollution. The pollution we cause contaminates our environment, lowers our quality of life, and will cause harm to animals in the environment as well.
As a case example, let's use the Mnisi community that we've discussed in our One Health blog week. Within the community, only 1% of the population has access to chemical or flushing toilets, while an astounding 71% of the population makes use of pet lanterns without any ventilation, and 23% of the population, or thereabout, has no access to toilet or toilet systems at all. This is clearly problematic because it creates a setting within the community where people use resources such as roads and rivers for urination and defecation. This will in turn attract rodents, vectors, flies, and other unwanted stuff, which will affect humans and animals both. And as we've established from this blog, this is clearly a problematic cycle of disaster.
Only 2% of the members of this community have washing machines. 88.4% get their water from regional or local service providers. 10% get their water from boreholes. If waste is not disposed of appropriately, it can indeed contaminate water sources which are actively being used by others. Animals drinking this water can get sick. Contaminated water will be used to water plants, especially in the case of communal farming. As the water quality declines, so too will the quality of human, animal, and environmental health.
We are looking at transmission of internal parasites, poor drinking water quality, diseases that spread via fecal-oral route, vector-borne diseases, and many, many more. This is just one case example, looking at one or two issues within a community, among the many one can possibly identify.
So what are we left with? A pollution wreck. Nothing speaks preventative action quite like education does. Efforts to help the community should also focus on long-term, holistic, and sustainable improvements. Stakeholders should also go hand in hand with education, as these are the people or entities who should be most involved with the community. Stakeholders such as municipal service delivery, the Kruger National Park, state veterinary services, community healthcare workers, paraprofessionals for more hands on the ground, and many more. If all the stakeholders work together on sustainable improvements, we can shift the heavy pollution weight and restore the balance with a One Health approach.
One Health is not a buzzword. It is also not as simple as a med or vet collaboration. It has been around and will continue to exist for as long as the interfaces between humans, animals, and the environment exist. For true, holistic, long-term sustainable improvement of any community, we will always have to make use of a transdisciplinary approach, contextually evaluate the possible issues at and risks associated with the various interfaces between human, animal, and environmental health, as well as keep stakeholders involved and accountable.